I'm trying to get it on screen. Okay. So what we have discussed so far is in listening part B, you have mainly two categories of questions. One category that falls into the main idea group of questions where you need to understand the overall viewpoint, and then there are some questions which can be identifying a particular detail within that conversation. So, and in main idea questions category, we have discussed so far that in main idea questions category also you have four subcategories. Last time when we had the session, we looked at mainly the purpose questions. This time we are looking at function questions. And the typical prompt for function questions will always be this: what is someone doing? So it's really easy to identify that that particular question is a function question. Although the attempting that particular question and getting the answer is difficult when it comes to function question. I would explain you the strategies today. How do you do it? So because it falls into the main idea category, you are going to look for the overview of that entire 1 minute conversation. Now, when it comes to listening, be it part A, B, or C of listening, your pre-listening is very, very important. So we are going to do one question with detailed pre-listening, and then I want you for the next questions to do that activity on your own, and then I'll take you through those questions and we'll discuss the answers as well. So you'll always have a context sentence which will tell you where the conversation is taking place and between whom. You can see here it says it is between a senior nurse and a student nurse. So what kind of conversation can they have if it is a senior nurse and a student nurse? So you can expect that it must be, giving some instructions or advice. Now we also have a background that it is about an incident with a patient. That means this cannot be about explaining a procedure, or explaining a protocol, or giving instructions on something, but this is more likely to be a feedback, right? It is more likely to be a feedback session because the incident has happened already. And then the senior nurse is discussing with a student nurse. And it is about a recent incident that might have occurred between a student nurse and a patient. So obviously that is the reason why senior nurse is asking them. Now look at the question prompt. It says, what is the senior nurse doing? That means my focus is to pay attention to the sentences or phrases that are given by the senior nurse. So what we do next is we try and predict what kind of conversation would it be. For example, here you have three answer choices. Yes. So can you identify the verbs in each of the answer choice? Because what is someone doing is mainly about action. Yes. And these actions, obviously, because they are doing it by speaking, they are more likely to be the actions which can, someone do by speaking. So in these three options that you have A, B, and C, can you type in which verbs are used in each of the option? Underline, it says underline the verbs in the options. Now you can't underline here, so I want you to type in the verbs from each of the answer choice. Can you do that for me? Verb is an action. Yes, so one is advising, then trying, yes, but trying to find out. This entire portion is the verb, right? Trying to find out. Trying what? Because try is kind of a very large context. So trying to find out and reassuring. Now we don't stop here. Okay, we don't stop by just underlining the keywords. We don't stop because it is not a mechanical process. In pre-listening, you have to do multiple things simultaneously. So you read the question, you think about it, you predict the kind of conversation that they're going to have, and then you try to highlight or underline the keywords. So it's completely intellectual process, not mechanical process. Now, if, for example, let us think if A is the correct answer. Okay, if the nurse, say for example, is advising, then what kind of phrases can I expect? Okay, they might be giving advice on you should do something, you must do something, why don't you try something, it would be a good idea to, it is very important to, you should not forget doing this, it's mandatory to, it's essential to. So if majority of the sentences that you hear in the audio are on giving suggestions, right, uh, then it could be advice. Now here another important keyword you have here is in future. So after reading this, you also get to know that this incident might be a problematic one, and that is why probably the nurse is giving advice on how they can avoid this kind of problems in the future. Now, second option is trying to find out. Okay? So find out means when you inquire, okay, when you ask questions. So if the nurse is trying to find out, from her side, you will listen a lot of questions. When did it happen? Why did it happen? How did it happen? Why didn't you do this? Okay? Why didn't you address the patient's concern? Why didn't you give the medication on that time? So if she's trying to find out exactly where he went wrong, so here also you get to know that definitely something has gone wrong. Now we have to just find out what is the nurse doing. Is she trying to find out what went wrong, or is she trying to give advice on how it can be avoided in the future? And third one is reassuring. Right? So if it is reassuring, we know that to reassure means to make someone feel comfortable, make kind of calm someone down, kind of make them feel comfortable. So if reassure is the answer, the nurse might be praising them or saying that it's okay to have this, you managed well, you did the right thing, right? So see, for each question that I get in listening part B, I get 15 seconds time. So you can imagine how fast you have to be. Okay, your thought process has to be really, really fast. And underlining the keywords, remember, is not a mechanical process. You actually have to think about the possible content of the audio, because once the audio has started, you can't pause it, you can't stop it, you can't go back, you can't rewind it. So that is the reason you be prepared to listen for a certain kind of information with the help of answer choices, so that when the audio starts, you can um, follow the conversation because you've already imagined some of the aspects of it. Okay? So I have to find out overall what is she doing. It may be possible that you may have one question, it may be possible that you may have one piece of advice there, and one sentence can be about reassurance as well. But you have to look for overall what is she doing. Okay? So you have to look for overall what are the majority of the sentences are they about giving advice, are they about questioning, or are they about reassuring the nurse? So now I'm going to play this audio. Okay? And I want all of you to type in your answers for this question as soon as you decide. here you go. I'm going to get the question again on screen. Yeah.
Have you got a few minutes to have a chat about what happened this morning?
Sure, I've just finished my shift and I would like to talk about it.
Great. So, how do you think you handled the situation?
Well, it was difficult because the patient became extremely aggressive after he heard that his operation had been cancelled. He just kept yelling at me. I tried to remember what you'd said about how important it is to stay calm in these situations, and that seemed to do the trick.
It generally does, but it's not always easy to do that. Anyway, it sounds as though you coped. Is there anything you'd do differently next time?
I think I'd offer to find out what had happened, why the operation wasn't going ahead. Then the patient would understand what was going on.
Now I'm playing this for one more time.
Have you got a few minutes to have a chat about what happened this morning?
Sure, I've just finished my shift and I would like to talk about it.
Great. So, how do you think you handled the situation?
Well, it was difficult because the patient became extremely aggressive after he heard that his operation had been cancelled. He just kept yelling at me. I tried to remember what you'd said about how important it is to stay calm in these situations, and that seemed to do the trick.
It generally does, but it's not always easy to do that. Anyway, it sounds as though you coped. Is there anything you'd do differently next time?
I think I'd offer to find out what had happened, why the operation wasn't going ahead. Then the patient would understand what was going on.
Okay. So now I want all of you to type in your answers. Okay. So we have A, B, and C, all answers selected by some of you. So let me explain you all of them. Okay. Now I'll explain that to you with the help of transcript. Let me just get the transcript. So at this stage, I don't have the transcript, but yeah, I would just help you understand this way, and then definitely if you have particular question, I can play it again for you. Okay, so here, see, definitely we had something about future here. Yes, she did ask, and would you do anything differently? Would you do anything differently in the future? So, yes, definitely there was something about the future, but was she giving advice or was she asking the nurse, the student nurse himself, how he would change, right? Those sentences came from student nurse, the male nurse, who said that probably I would try and find out why the operation isn't going on so that I can calm them down or I can give them the reasons. So it was not the nurse was not advising on how he can avoid this kind of problems in the future. Then we definitely had some questions when he said that, I would just try to, know about the incident. So you did have question, but that was just one question, not overall. So C is the correct answer here, reassuring him because he said, the nurse said, the senior nurse said, you coped well, right? And that does help. So all the sentences that you heard from the senior nurse's side were all positive, okay? And that helps you select C as the answer because she did not express her uh, kind of unpleasant behavior, or she did not express her unhappiness about the given situation. She was in fact reassuring that you coped well by saying it. So C is the correct answer. Now let me see how many of you could get it correct. Okay, 2 of you could get it correct. Yeah. So in the beginning, we did have this question when she asked, let me play it again for you. But that was just to begin. That was the purpose for which she was discussing. Here you don't have to find out purpose, you have to find out function. What is she doing during that 1 minute conversation?
Have you got a few minutes to have a chat about what happened this morning?
Sure, I've just finished my shift and I would like to talk about it.
Great. So, how do you think you handled the situation?
Well, it was difficult.
Right? So the question also is, how do you think you handled the situation? Whereas here it says exactly where he went wrong. So she never asked where he went wrong. She was just trying to find out how it went. And then the male nurse himself was explaining.
Because the patient became extremely aggressive after he heard that his operation had been cancelled. He just kept yelling at me. I tried to remember what you'd said about how important it is to stay calm in these situations, and that seemed to do the trick.
It generally does, but it's not always easy to do that. Anyway, it sounds as though you coped. Is there anything you'd do differently next time?
I think I'd offer to find out what had happened, why the operation wasn't going ahead. Then the patient would understand what was going on.
Have you got a few minutes to have a chat about what happened?
Yes. So here she's not advising. She might have advised earlier. That is why the student nurse was saying, I remember how you said that we should remain calm. Okay? Then find out was not about what or where he went wrong. It was generally about the incident. So it was reassuring. So you pay attention to the verbs, and then in fact you have to understand exactly advising on what is she trying to find out, and reassuring the patient. Now let us do the next question. Again, function question. Okay, so you have got the question on screen. This is your context sentence. Okay, and this is the question. Do you see the prompt? It's really easy to identify the prompt because of the type of, or the way in which it is designed every time. So it is a hospital physiotherapist who is talking to a trainee. Again, this time you have more of instructions kind of questions where the physiotherapist, the senior one, is talking to a trainee. The topic is also given cardiac rehabilitation program. And the question says, what is she stressing? So now it is already given that the physiotherapist is stressing something. What does the word stress mean here? It has nothing to do with mental disturbance, but it is emphasizing. Right? What is something that she is trying to say that something is very, very important here. So now let me know, what do you predict if this is the correct answer? Best way to monitor reactions. Reactions. What comes to your mind when you hear the word reaction? And the best way to monitor patient reactions. Type in the chat box. What do you think could be the discussion if this is the correct answer? The way we did for first question, I want you to do the same thing for second question. Yeah, so it can be positive or negative reaction. So at least it is clear that this has to be the psychological aspect of it. It is not the reaction to any medication because it is physiotherapist. Okay, and it says best way to monitor. So how can we monitor their reactions? Can you think about it? What kind of conversation would be there if this is the correct answer? We are trying to predict that. So if the best way to monitor by observing, yeah, natural, right? How can you find out or monitor patients' reactions is by observing their expressions, their the way they look at it, their smile, whether they are grimacing or smiling, okay, or their eye movements, their body language, posture. So if this is the correct answer, then you will have that kind of conversation here where the physiotherapist will be training the trainee on how to monitor patients' reactions, how to put an eye on or keep an eye on their body language, on their facial expressions, on the movements of their eye. Similarly, second one, advantages of a certain approach. What do you mean by certain? Now, this is very typical of listening part B, where you may not have the exact word as it is in the audio or in the question itself. It will always be generalized. So, certain approach means any one approach, isn't it? Yeah, a certain, specific. Yeah. And advantages. What do you predict here? If this is the correct answer, what kind of sentences or phrases can you expect here? Benefits, yeah, advantages is benefit. So if this is the correct answer, they might be describing one particular approach and its benefits. Yeah, just one approach of cardiac rehabilitation program and its benefits. Yeah, did someone say something? Yeah, and if third is the correct answer, the need. What do you mean by this? If this is the correct answer, what kind of sentences do you predict? The need to motivate. Yeah, the need is requirement. So what kind of conversation do you predict here if this is the correct answer? When I try to emphasize the need of something, what kind of sentences would I use? I would say it's very important to, they need this, they require this, okay, and motivating the patient. So obviously it is going to be more about the encouragement, but it's not about how to encourage them, okay, or not the benefits of encouragement, but the need, why it is important for a physiotherapist to motivate their patients. Yeah, the need to means, yeah, you can say that you have to do it, but in fact what it is trying to say is not you have to do it, but it is essential to do. It's essential or it is recommended. Yeah, it's something that is very, very essential or important. And here also you have this word stressing, right? So what we do, this is what we do in the listening part B questions. You will always listen to a conversation between a healthcare professional and another healthcare professional, or it could be a healthcare professional and a patient. And it can be from all the 12 professions that you have in the OET test. So it may not be this profession specific. You can have dialogues between other healthcare professionals as well. But they all will be the dialogues which are taking place within the hospital. That means it could be rehab center, it could be hospital, clinics, okay, but it is workplace related. And the type of question that we are discussing today is particularly function questions, where you have to identify while speaking what are they doing. So you might have noted some of the verbs that are very common. Yeah. So I would recommend that all of you make a note of verbs which are very common for function questions, because if you have to speak and do certain things, it's very limited. The room is very limited because nobody can kind of demonstrate things, they can't depict things. So there is a very limited way in which they will be answering this question. So it can be advising, instructing. Similarly, here you have stressing, which is emphasizing. So make a list of these verbs which are seen in function questions and try to understand the minute difference between them. Like what is the difference between advising and reassuring? What is the difference between stressing and explaining? So explaining is when you just simply explain something, but stressing means you give a lot of importance to it. You try to emphasize a particular aspect of it, right? And then you predict uh, the type of conversation or the type of sentences that you will hear in the audio with the help of this keywords from the answer choices. So now I'm going to play the audio for this particular question where you will hear a physiotherapist and training. This time also I'm going to play it twice so that you can understand the conversation well and you can select your answer.
After cardiac surgery, it's important that we get the patient moving. They don't always want to, usually because of fear. They've just had a sternotomy, so they're frightened it might burst open.
I would be too.
We have to encourage deep breathing from the outset. For this, we use an incentive spirometer, a very important apparatus to help prevent pneumonia, amongst other things. The next step is to start ankle pumps and circles to help prevent the pooling of blood in the lower extremities.
Okay, they sound simple enough.
Not so simple for them. So it's important you explain why they're doing the exercises. The next step is standing and sitting. They'll clutch their chest with a pillow to stop from using their arms. It's vital for flexibility and muscle tone. Finally, we get them ambulating. How far they walk determines when they can go home. That's always a good incentive.
Okay, this is for the next time that I'm playing this.
After cardiac surgery, it's important that we get the patient moving. They don't always want to, usually because of fear. They've just had a sternotomy, so they're frightened it might burst open.
I would be too.
We have to encourage deep breathing from the outset. For this, we use an incentive spirometer, a very important apparatus to help prevent pneumonia, amongst other things. The next step is to start ankle pumps and circles to help prevent the pooling of blood in the lower extremities.
Okay, they sound simple enough.
Not so simple for them. So it's important you explain why they're doing the exercises. The next step is standing and sitting. They'll clutch their chest with a pillow to stop from using their arms. It's vital for flexibility and muscle tone. Finally, we get them ambulating. How far they walk determines when they can go home. That's always a good incentive.
Okay, so now I want you to type in your responses. Okay. So almost everyone goes with B, and yeah, we have one student writing C. Yeah, So we discussed that it has to be a certain approach. Was she talking about a specific approach, or whether it was a range of things that were being described? Look at this. The transcript is right from the beginning. Started with, it is important that we get the patient moving. We have to encourage deep breathing from the outset. The next step is to start ankle pumps and circles. Okay? And when the trainee said it sounds simple enough, the physiotherapist emphasized not so simple for them. So it is important to explain why they are doing these exercises. And then they explained that after doing all those exercises, the final step will be to get them moving. And how far they walk can be a determining factor for you to decide when they can go home. And that's a good incentive. So, wasn't it about the patient's emotional reaction to it? Yes, you definitely, they were not describing the ways in which you can monitor the reaction, but it was mainly about how they feel, because here they've said they have fear, right? And they don't usually do it, and therefore she's trying to explain how you can encourage them to do activities. So C is in fact the correct answer here. Yeah, because what is she stressing? She did explain the advantages of doing ankle pumps using spirometer. She did explain the advantages of, making them walk. But what was she trying to stress here? What was she trying to emphasize here? Is it's important to motivate them because they are fearful. They don't find it simple when the trainee nurse said it is very simple. So C is the correct answer here. It was great that none of you went with A because, yeah, definitely she did not give any information about how to monitor their reactions. This was very catchy because with every step she was trying to explain how it could be beneficial for the patient, but that was not the emphasized portion of it. The need for motivating them was being emphasized, isn't it? Let us do next question and see if you are able to apply the strategies. Again, it is a function question. So what we are going to do is all of them are same types of questions. So it becomes easier for you to practice one category of question. Okay. So now third question. Here also you hear a surgeon giving details of surgical complication to a patient. Now here also it is given that the surgeon is explaining risk factors to emphasize what? So again, what is the surgeon trying to emphasize? Right? In this type of questions, the main challenge that you have is that you will hear something about each option. Okay? But you have to go for the what the question is asking you. The question is asking you what is he trying to emphasize. So you have to go by the overall summary of that entire 1 minute conversation. So let us start predicting from the answer choices as well. What kind of discussion do you expect here? It is a surgeon who is giving details of a surgical complications to a patient. So when do you think this conversation may be taking place? At what point it may be taking place? Or what kind of discussion will it be? Preoperative, yeah, exactly. Because When you are trying to get informed consent from your patient, you need to explain them about the surgery, about the preoperative, perioperative, during the operation, what would happen post-operatively, what are the risks associated with it. So if you try to relate it to your own workplace, this will become easier for you, right? All of you have chosen OET mainly because it can help you feel familiar with the topic. So here also, if you try to relate to your clinicals, it would be easier. Now, let us look at the answer choices. Now, this is taking place preoperatively and it is discussion on surgical complications. So, what all things do you think will be discussed here about surgical complications? What do you think the doctor will be describing about surgical complications? What kind of complications can occur, right? Their discussion, depending on, we don't know at this point what kind of operation the patient is going to have, but depending upon what kind of operation they are going to have, they might have some discussion on what kind of complications can occur, whether those complications are very common or very rare, how it will be dealt with, what the patient has to do to avoid those complications, isn't it? This can be the possible content of this entire extract. Now let us look at the answer choices and let us try and identify what is the difference between the two answer choices and how those three answer choices are different from each other. So here also it says the need to, okay? The need to investigate any symptoms. What kind of sentences do you predict here if this is the correct answer? The need to investigate any symptoms. How the surgeon will be telling this thing to the patient. Can you imagine a phrase or a sentence? Because what you have written here is not exactly how the surgeon is going to explain, right? The surgeon would not say there is a need to investigate any symptoms. Require any blood test, but it says symptoms. Investigate doesn't always mean doing tests. It says symptoms. Investigate any symptoms. So, and imagine the doctor is explaining to a patient. So the doctor would not tell the patient which test will be done. Do we tell our patients which test will be done? No. If complications occur, which test will we do? No, it can be overwhelming for them. What do we tell them? Infection? Yeah, infection could be one of the complication, but if A is the correct answer, what kind of conversation? Uh, But this, we already discussed that the surgeon is trying to talk about complications in the future. Yeah. And it says need to investigate any symptoms. So it is not about doing tests. Isn't it about telling the patient what kind of symptoms can they have after the operation, and those symptoms may indicate that there is a complication, and then the surgeon may go and tell the patient that you have to be careful about these symptoms. If you develop any of these symptoms, then you should come and check with us because we need to do further testing or we may need to do further assessment. So when it comes to the word investigate, do not just think about the test. To investigate means what? To try and find out, to kind of get into the details of something. Right? So investigate always does not mean doing tests. And here it says investigate any symptoms. So probably if this is the correct answer, the surgeon will be telling them that these are the possible symptoms that you may develop and that may indicate that there is a complication. And so if you develop any of these symptoms, then you should come back and check with us. So we may need to do further assessment, or that assessment may also include tests. That could be one aspect of it. Okay. Second, additional surgery may well be required. This well is making a huge difference here. What kind of conversation do you expect if this is the correct answer? Additional surgery may well be required. Well is very, very important here. If I just say may be required, I'm not trying to emphasize. May well be required, there is more probability, isn't it? So probably the considering the patient's current situations or considering the patient's current symptoms, the doctor might be telling them that, see, in this year, in this situation, like considering your current situation, there are very high chances, may well be required. So well be required tells that the chances are high that they may need additional operation. So do not, even though we are underlining the keyword, do not keep listening only for those words, okay? If they say one word about additional surgery or if they say one word about investigations, it doesn't mean that that answer is correct. That's the main trap. You need to go for overview. Okay, and last one, severity of what some consider a minor operation. If this is the correct answer, then what kind of conversation do you expect? The severity of what some consider a minor operation. So people usually think that it is a minor operation, but the surgeon is trying to explain, okay, how severe it is. No, it doesn't mean depending upon severity. This option means people usually think that this is a minor operation, but surgeon is trying to explain to the patient that it is not a minor operation. It can be very serious, or it probably can have very serious complications. Severity of what some consider a minor operation. That means severity of operation, not severity of symptoms that they are having right now, or not the severity of complications that they are likely to experience in the future. Right? So this really, expects you to be 100% involved in what you are listening to. It's not just listening one word and choosing the answer. Right? And that's where all this practice tests, like before you will go for your actual exam, you will go through 35 such practice tests. 35. Now these 35 tests are going to be helpful to you only and only if you practice with the right strategy. Okay? If you practice without any strategy, if you practice just what comes to your mind, and if you do it without strategy, then that's not going to be helpful. That is the reason why I go slow when we are practicing this strategy. Right? And do not focus initially on time. It's okay if it takes you 5 minutes to analyze one question. But if you haven't understood the question and answer choices, and if you listen and answer that question, you are bound to get wrong answer. So don't do that. Or sometimes even if you get correct answer, it may be just randomly you have got the correct answer without actually understanding the logic behind it. So now I'm going to play this part, and then we are going to discuss this answer. This is also something that I would play twice so that you can understand it fully.
As with any surgical procedure, there are possible complications which you need to consider.
I see.
Tonsillectomy is common, but can pose considerable risks, especially in adults such as yourself. So, monitoring for and reporting any signs, especially in the first few hours, is crucial. You'll be having a general anesthetic, and although reactions are quite rare, it does have potential dangers. During the operation, there's the chance of excessive bleeding requiring further treatment or intervention. After the operation, swelling of the tongue and soft palate can occur, leading to difficulty in breathing, and, of course, bleeding may occur during this time also. This is also when infections can occur. Now, I must stress again that although such complications are rare, if you do experience any discomfort or if anything's worrying you, you must contact me immediately.
Okay.
As with any surgical procedure, there are possible complications which you need to consider.
I see.
Tonsillectomy is common, but can pose considerable risks, especially in adults such as yourself. So, monitoring for and reporting any signs, especially in the first few hours, is crucial. You'll be having a general anesthetic, and although reactions are quite rare, it does have potential dangers. During the operation, there's the chance of excessive bleeding requiring further treatment or intervention. After the operation, swelling of the tongue and soft palate can occur, leading to difficulty in breathing, and, of course, bleeding may occur during this time also. This is also when infections can occur. Now, I must stress again that although such complications are rare, if you do experience any discomfort or if anything's worrying you, you must contact me immediately.
Okay.
Okay. So you understood the difference between function question and detail question? All of you could get correct answer, right? So yes, we did hear about additional surgery. There was something about how severe it is. They did mention that it could actually cause serious complications. Yeah, but that was not the reason. That was not something he was trying to emphasize. What he was trying to emphasize is that these are the possible dangers. Okay? They can have dangers like they can have excessive bleeding, they may require further treatment, they can have swelling, okay? Difficulty in breathing or bleeding, and infections can also occur. Now, I must stress again that although such complications are rare, so this is something that helps us rule out option C, severity of what some consider as minor operations. It is actually a minor operation. It is not that severe. But patient has to be aware about the possible complications. So if you do experience any discomfort, you must contact me immediately. Now, if you had kept that investigation in mind, then you would definitely not go with option A, right? Because you would think that he did not talk about any test. So therefore, A is not the correct answer. So remember that investigate is not only for the test, it is to assess, to check, to be evaluated, okay, and investigate any symptoms. So the doctor was trying to emphasize that if they develop any of these symptoms like swelling, bleeding, infection, then they must contact the doctor immediately. Okay, so it was great that almost everyone could get correct answer here. Excellent. Answering function questions within the test. Okay, so this time I'm not going to help you with underlining of keywords. I want all of you to do it yourself and type in the chat box so that I get to know. First, type in the keywords from question and from the answer, and then we are going to discuss what do we expect in this part of the conversation. So here it is suggesting ways of, yeah, so some of you have selected suggesting motivating patients. So, isn't ways of motivating an important word? Because just we did the previous question and there it was about need to motivate patient. So is there any difference between need to motivate patient and ways of motivating patient? All of you feel free to unmute yourself and discuss this. I want all of you to discuss this with me so that I get to understand whether you are, how you are looking at the answer choice and how do you interpret them. What do you mean by ways of motivating patients? Because here all three verbs are quite similar, suggesting, explaining, outlining. What do you mean by outlining? What do we do when we outline? We highlight. Yes? So it is similar to emphasizing or suggesting. So how is it different? Ways of motivating patients.
How to motivate patient? There are some ways.
Yes, right. So this is not about need to motivate. What we did in the beginning was need to motivate, how important it is to motivate. But here it is ways of motivating. So through which ways or through which techniques or tactics can you motivate your patient? So my keyword for this answer choice is ways of motivating, not just motivating. Ways of motivating patients. Okay. For question number two, option number two. Here, what is the keyword? Ishan, can you tell us what is the keyword or how do you interpret this option? Option B.
She is trying to get exercise may not always be appropriate for this condition.
Yes, but why is very, very important here.
Yeah, yes.
She's trying to explain the reasons. Yeah, the reasons why exercise may not always be appropriate. So can you think of a content that you would hear in this part of the conversation if this is correct answer? What kind of sentences or phrases may the nurse educator use? And when it says not always be appropriate, so that makes again a huge difference. Not always be appropriate. That means what?
Means sometimes it may be possible. Yeah,
Hmm. Yes. So what kind of phrases do you think she would use here? She might enlist conditions where it is not appropriate. Yeah. She may say in which situations it is not appropriate for patients to exercise, and then she may go on to give reasons. For example, she may give an example of a very elderly person, and then she may say that if they exercise, then they can have this complication, so they should not exercise. So if B is the correct answer, then she might be explaining in what situation they should not exercise or in what situation patients with asthma should not exercise and why they should not exercise. Okay. And for this one, Nikita, can you explain us how do you interpret third option and what kind of phrases or sentences do you expect if this is the correct answer? Outlining the steps in setting up an exercise program.
Ma'am, the educator will explaining those steps which are taken in exercise program, like what kind of exercise uh, they have to do, like.
But it says steps in setting up an exercise program. It is not about what type of exercise would they do. What do you mean by setting up an exercise program?
To organize.
Yes, when you develop or design an exercise program.
Yes.
Yeah. So here it may not include what type of exercises, but it is steps. Like, what are the steps that you take? So maybe first you would check how much is the patient's tolerance, what is their current situations, how much is their PEFR, how much exercise would they be able to tolerate. Then you go on to set up exercise for them, when you would decide how frequently they should do it, how for how much duration should they do that exercises. So steps in setting up an exercise program. So if this is the correct answer, they may be explaining as to decide on which type of exercise, for example, then decide time, duration, or frequency. Or they might also talk about certain factors which they should consider, for example, age of the patient, their current PEFR level, or maybe if they have any other associated problems, like patients with heart disease probably would not be suitable for exercises. So if this is the correct answer, they would explain what is the first step, what is the second step, what is the third step, right? And if B is the correct answer, we would hear reasons. Reasons for not doing exercises. In what cases patients with asthma should not exercise and why they should not exercise. Okay. Is everyone clear so far about the question and the answer options? Yeah, it simply says what is she doing. So we have to define that first, whether she is suggesting, explaining, or outlining. And then we have to look at this, whether it is about methods or techniques, whether it is about reasons, or whether it is about step-by-step process of setting up, designing, or developing an exercise program for the patient. Nurse educator talking to trainers. So I'll play this audio for two times so that you can listen to it carefully and answer it.
As with any surgical procedure, there are possible
Okay, now some feedback on how you've been taking blood pressure on the ward.
Sorry, I'm just not able to find out the correct audio.
Okay, so when you're dealing with asthma patients, it's quite likely that they'll ask you about exercise, and you're going to have to make a quick assessment of what it's appropriate to say. Basically, by giving their lungs a regular workout, they'll cut the risk of asthma symptoms. But if they've never had a regular exercise routine before, the first thing they need to do is go to the GP for a checkup and make sure their asthma action plan's up to date. Most patients can fit some regular exercise into their week, and you should stress that little changes will make a huge difference. So simply just walking the kids to school or taking a walk in the lunch break instead of sitting down could make an enormous difference. Also, if they can find somebody they know who's willing to go with them along that journey, that'll help massively as well. But remind them that whatever they do, they'll always need to have their blue reliever inhaler with them.
Okay, now I'm playing it for the second time.
Okay, so when you're dealing with asthma patients, it's quite likely that they'll ask you about exercise, and you're going to have to make a quick assessment of what it's appropriate to say. Basically, by giving their lungs a regular workout, they'll cut the risk of asthma symptoms. But if they've never had a regular exercise routine before, the first thing they need to do is go to the GP for a checkup and make sure their asthma action plan's up to date. Most patients can fit some regular exercise into their week, and you should stress that little changes will make a huge difference. So simply just walking the kids to school or taking a walk in the lunch break instead of sitting down could make an enormous difference. Also, if they can find somebody they know who's willing to go with them along that journey, that'll help massively as well. But remind them that whatever they do, they'll always need to have their blue reliever inhaler with them.
So now I want all of you to type in your answers. Okay, so 2A and 2C. More people going with C. Yeah, so we did hear that, if they have not done any exercises before, then they must first have an exercise program, or they must have an asthma action plan. But did we hear steps? And in fact, the nurse clearly said that it is the GP who sets up an exercise or asthma action plan for the patient. Can you see this here? When she said that first thing they need to do is to go to GP for a checkup and make sure that asthma action plan is up to date. That's something GP has to do. And this was for trainees, the trainee nurses. So she is explaining how in the beginning also she said that here that you would need to have a basic assessment whether they can go with exercises or not, right? And then she said here, in what ways can you motivate them is by explaining them that even a little change will make huge difference, then giving them suggestions on how they can take up exercise, okay? And also involving another family member or a friend to make sure that they remain encouraged towards the exercise program. So it was not step-by-step process as to first what they have to do, second what they have to do. No, it was simply saying that they can do some regular exercise. Again, it did not say what kind of exercise. And the most important criteria that we had decided if this answer is correct is we were looking for, yes, we discussed that if this is the correct answer, they may be discussing how, yeah. So if this was the correct answer, they may be discussing how, what points are to be considered when setting up an exercise program, depending on their age, depending on their PEFR level. How would you set up, how would you decide exercise programs? We didn't hear anything about exercise program as such. Did we hear what kind of exercises? No, it was just about going on a walk, dropping their children to the school, or walking during the lunch break. So there was no formal kind of exercise that was being discussed here and the steps in which you can set it up for them. So A is the correct answer, suggesting ways of motivating patients to take exercise. Yeah, A is the correct answer. Okay, now for the next two questions, we are going to do it timed sessions, which means I'm going to give you only 15 seconds time to read the question, okay, and then answer that question. So you can imagine or you can see exactly where you stand if you have to do it at that speed. Okay, so I have got the question on screen. Okay, and now I'm going to play the audio.
Okay, now some feedback on how you've been taking blood pressure on the ward today. Before you report a reading that seems outside the normal range, check that the cuff you're using isn't too small, as this can push up the reading. I'm pleased it's not been an issue for you, judging by what I've observed. However, the patient must be in a position that's comfortable, and sometimes you're not quite managing that. To be more precise, please ensure in future that both the back and arm are supported, with the upper arm at the same level as the heart. You all seem to have taken on board that quite a few patients will be nervous when they're with medical staff, and this may result in significantly higher blood pressure. So it was good to see you weren't too alarmed by some of the higher readings today.
So you hear something about each option, something about the cuff size, something about the position, and something about the nervousness. What seems to be the main point that he's trying to make? Yeah, that's excellent. Everyone going with C. Very good. Yeah. Right. So this is how, if you would use the right technique, it's very much possible that you would get 5 answers correct out of 6. It's very much possible and achievable goal, provided that you do your pre-listening well. Okay. Next question. So I'm not explaining this any further because all of you have got it correct. C is the correct answer here, because for the cuff size, he said that that hasn't been a problem for you. And even for the nervousness, he said that all of you have taken it on board. That means those 2 issues are not particularly relevant for this group of students for whom he is giving the feedback. Right? He explained clearly that I'm pleased it's not been an issue for you. So these students do not have issues with cuff size, but he emphasized, to be more precise, please ensure in future. Right? So this helped us understand this is something he was trying to emphasize. And then he said it was good to see you weren't too alarmed. And this is always be careful. The negatives will always come like this. You were not alarmed. It's very easy to identify, but you weren't. You can easily miss the negative there. Okay? So be very, very careful about negatives. Okay, now final question, 6th one, and then we would move on to part C. Always pay attention to negative words in the answer choices. Okay, now I'm going to play this part.
So, Mr. Clark, you'll need to keep the cast dry, which means covering it with a plastic bag when taking a shower. I'm sure you'll manage.
If the cast does get wet, I can use a hairdryer, can't I?
Yes, put it on a cool setting, though. One other thing, it's easy to forget to exercise the shoulder and the elbow. Don't sit all day like a statue.
Right. And it's not normal to feel any tingling or numbness.
It's unlikely to happen, but inform us as soon as possible if it does. After a day or two, some people can start to feel the cast is too tight or too loose. Again, if that's an issue, you should let us know.
Okay, so you can adjust it?
Actually, we can replace the cast if there's any discomfort.
Ah.
Type in your answers, please. Great. Yeah, so here A and C were really confusing because she did talk about exercises, but did she talk about types of exercise? She just mentioned that it is important to exercise, or she mentioned exercise about of the shoulder and neck, but that's not type of exercise, right? Type of exercise for like ankle pumps, deep breathing exercises. So she simply said it is easy to forget to exercise the shoulder and the elbow. Nothing about types of exercises as such. So C is the correct answer here because she is explaining that if they have numbness, they should contact the hospital. If they feel that the cast is too tight or too loose, yeah, here it is unlikely to happen, but inform us as soon as possible if it does. So if they have numbness, they should inform. If the cast is too tight or too loose, the patient is supposed to inform the nurse about it, isn't it? So C is the correct answer. When it would be necessary. So this is your key word here. When it would be. When should they contact the hospital? Okay. And practical difficulties. So she in fact said, I hope you would manage that, or I'm sure you would manage that. So she was not actually talking about the difficulties as to, while taking shower, it can get wet when you're trying to have for example, when you're trying to wash your hands after having food, it can get wet, or when you're trying to, maybe doing some work in the kitchen, it can get wet. So she was not, in fact, discussing this difficulty. And there was something about exercise, but not types of exercises, just exercising the shoulder and the neck. That's not type of exercise, but when to contact the hospital. Yeah, so that's all about this part of the test. Yeah, we mainly looked at function questions today. So I hope after today's session, you will be clearly able to remember what kind of questions are function questions and how to deal with this kind of questions. The main category is main idea here. So whenever you are dealing with any of the main idea question, you don't get taken away by just one word or one sentence that you have heard. You go for the major idea, the overview or the main idea of the entire conversation.